I am Dr. Beji Jaison. I am pediatrician at Royal City Clinic, Jalib. Today let us discuss about newborn care. It is said that every newborn comes with the hope that God is not yet discouraged of man. So it will be a great thing if every parent gives birth to the child in his mind before the child comes in the womb. When I say this, I also mean that the mothers and the parents to be need to be prepared. There are certain ways in which a mother can be prepared. She needs, as soon as the parents decide that they should be having a baby, the mother should be beginning to take folic acid. This prevents any kind of neural tube defects in the child. Adequate diet and the correct kind of diet is very important to have a healthy baby. Before the baby is born, a mother should examine whether her breasts are right for giving breastfeeding to the child. If the nipples are retracted or flat, then if they need addressing, it should be done prior to the birth of the baby. Once the baby is born, the first thing that a mother needs to do is give the child a skin-to-skin contact. And then the child should be immediately put to the breast so that the child starts breastfeeding. It is very important that the breastfeeding is given every time that the child demands or every 2 hourly. It is also to be known that a newborn can get warm very easily and can get cold very easily. So it is very important that the child should be swaddled in a proper manner. So what kind of cloth should be used for swaddling a baby? It should be a cotton cloth. A baby should never be swaddled in a blanket. A proper sized cotton cloth should be taken and it should be folded in a triangular manner, and the baby should be kept, the legs should be covered, the hands should be kept close, even the ears can come down, and the child should be swaddled properly. This is very important that the child is swaddled like this. The child actually sleeps for around 16 to 18 hours in a day. So a properly swaddled child does feel comfortable and warm. He doesn't become too heated if the swaddling cloth is cotton. It is nowadays believed that if you do not swaddle the baby and keep the hands a little bit free, that is also okay, because a child learns to experience his world, familiarizes with the world through his or her hands. And a child's hand, if they are free, then they can explore the world better. Once we have swaddled the baby and we can ensure that the child sleeps well and feeds well, we have to see just the rest of the things. I would just quickly tell you that whenever you hold the baby, please look into the eyes of the baby. It is important. Your baby does know that you are looking and talking to him. It is an extremely bad practice that you hold a baby and you look at the phone, because your baby can actually experience that the child is not getting adequate attention. The baby can only see 7 to 12 inches clearly. So the baby should always be held at that distance. If the child is further away from you, the child's image of you would be blurry. So the adequate distance would be 7 to 12 inches. At the same time, the baby's ears are very sharp and he can listen to exactly in a very proper manner. You would have noticed that there is a soft part on the head, which are the fontanelle. There are actually 2 fontanelle. The back one is very small, and maybe you haven't noticed that actually closes at 1.5 months. The front one closes at around 1.5 years. The importance of that is that if you find it is raised or if you find it is sunken, then it is something that you must be bringing it to the notice of your doctor. The child can sometimes have, the newborn can have nipples from which sometimes the milk is coming out. Please do not express that milk. Please do not squeeze the breast of the baby. There is no specific thing to be done to the umbilicus of the child, and it should be allowed to fall in its own time. The child has, the best thing is that you can keep the child holding. If you hug the child, it is always doing good to the child. When a child is hugged, there is release of oxytocin. And when oxytocin is released, it's a love hormone and your child can grow and get nourished. Some people believe that if you keep lifting the baby will get spoiled. That is a very bad, very wrong notion, because no child at this age has got that kind of a neural development where he can get spoiled. So attend to your child as and when it is required. Lift him up, touch him, hug him, look at the child, look into the eyes, sing to him, talk to him, and the child would actually thrive. The child loves to see colors, loves to see faces, loves to see smiles and the contrasting patterns.